Is ACTIVA BioACTIVE Restorative indicated for bulk filling? Does it have other indications?
I'll start off with that one. I've been talking about bulk fill for a long time, and I think bulk fill is a good topic to talk about because, as Dr. Wig alluded to before, placing direct restorations in today's world is a technique-sensitive thing. It's a time-consuming thing. So if we can eliminate some of the technique sensitivity and some of the time involved, but yet not compromise the end result, I think regardless of what we're doing, that's a good thing for our patient and a good thing for the doctor. So I've been used to the world, as many have, that composites are you go past 2 millimeters and you have to layer it. And I ask the question to the doctors in the audience. I know nobody has ever placed a 2.2 millimeter increment of composite, but I'm sure in the audience, but a lot of other people have. So even with that, the shrinkage issue has been an issue, just like sensitivity with dentists in their brain for a long time, because they remember a lot of the old data in research, which I think old data in research is perpetuated without the advantage of looking at newer materials. In fact, in the last 10 years, I think most composites shrink less than 2%. So my question always has been don't tell me that yours shrinks 50% less. Tell me if that 50% is actually clinically significant. Does it make a difference? Now with ACTIVA as a bulk fill, I think that's a tremendous advantage. Number one, it's dual cure. The problem with most bulk filled composites is they're still light cure. So you're depending upon the light to get down to the bottom of the increment and cure it. And I know the ISO standards, people will argue that they don't do them properly, that if they say it's a 4 millimeter cure, it's really a 6 millimeter cure and all that. Oh, that's fine. But with ACTIVA, you don't have to worry about any of that stuff. Whether the light gets there or not, the material is going to set. So is it meant only for bulk filling? The answer is no, but but it is a good bulk fill material. And I talk about that in caries control and things like that, that I used to use glass ionomer for years. Glass ionomer was also a good bulk fill dentin replacement, but it was only a dentin replacement because the wear capability and all that is not there for glass ionomer. So ACTIVA, it wears like composite. So it really is a good bulk fill material, but it's not only meant for bulk fill.
Yeah, totally agree with that. Yes.